I don't want underpaid. My doctor and my pilot.
John, you want to add anything to that one?
I'm a specialist physician, and I've had the privilege of taking care of some of the patients of the distinguished doctors to my right. With regards to your specific question, which was Dr. Zoe 53, I'm 55. I love what I do as far as being a doctor. What bothers me the most is all the non-patient doctor issues that are floating around out there. If Obamacare passes, I am very certain that the majority of doctors who are over 55 are going to, and these are the guys with the most experience, are going to want to get out ASAP. And so I am still thrilled to be a doctor. However, if Obamacare passes, that may change. Thank you.
Questions, right there in the ball cap. Let's get the mic. Brief questions, brief answers.
Yes, I'd like to just ask the doctors a question regarding getting out of the profession. I had a close friend who back in 1998 told me, he was a podiatrist, he was a surgeon, he told me he would not recommend his children going into the medical profession because, one, the insurance companies are out of control, and two, you can't make any more money about it in the profession, and the lawsuits that are involved. So this was 1998, 14 years ago, when we heard basically the same complaints we're hearing today. It's just shifted from the insurance companies to the cost that Obamacare is going to bring forward.
It's a really interesting point. Respond to that. What's different now? Is there anything different from what the gentleman said in 98?
Not being happy. Well, I think that the costs are obviously going way up. You can't go to the emergency room today with a cold and not come out of there without a huge bill because people are so afraid that they're going to get sued if they miss something. So that gets back to tort reform and that type of mentality. But for myself, I would like to tell these people that are trying to force me out of medicine to go take a big fat jump because I care about my patients. If I'm not their advocate, if I sell out, my patients become the property of some larger institution that's not going to look after them with the same care that I have, or I'm not going to be looked after with the same care that I would want. Consequently, that's the problem.
Interesting.
HMOs and insurance companies.
Yeah, interesting point. Were we 15 years ago, were we just angry at private insurance, and now we're just angry with Obamacare and big government? What's different, if anything? Go. And then, Steve, you can weigh in as well. Go ahead. Is it different now?
The difference is only in that the insurance company always tried to take control of your care. And it's always been a battle, and physicians have been fighting that. What they would recommend, what they allow, that is without a doubt an issue, and that needed to be worked on more and more so that we don't lose control. But having Obamacare come into play, it takes that to the 10th, 100th power beyond that. And the reason it really does is because it takes away the autonomy of the physician. Ultimately, I really believe that Obamacare is a stepping stone to socialized medicine. That all these entities will not really thrive. They will fail financially, and the government will have to come in and save the day. And we'll have socialized medicine.
Rich, you want to add anything?
See, when you walk into our offices, we are independent physicians. We work for you. You're our boss. So 15 years ago with the HMOs, the HMOs were telling us you got to do these things. The patients lost control. And it's the same thing. Now Obamacare taking control. So that's really stayed the same. They're taking the control away from you, the patients. Again, we want to be your advocate. We're going to tell you this. We can tell you the best thing to do, but it's ultimately your choice. Under the HMOs and Obamacare, you're not going to have a choice.
Stephen, you want to add anything? Hold up.
I do.
Him, and then we'll get to you.
Go back 14, 15 years ago, what was being pushed by Congress, both sides unfortunately, was HMOs. HMOs are probably, especially at that time, one of the most dangerous insurance products you could buy because they put the insurance company in charge of medical decisions. If you have a brain tumor and you want want to see Dr. Keith Black at Cedars-Sinai Hospital in California because he has a 99% success ratio for removing previously diagnosed as inoperable brain tumors. Good luck seeing him on a Chicago-based HMO. You can go, but you'll pay the whole cost. This is why the people rose up against HMOs and PPOs were implemented, so that if you are out of network, you still have a great deal of that coverage covered and paid for. There have been laws passed right here in Illinois, like the forced provider provision that states if you're out of network and it's an emergency situation, they can't charge you out of network. So there have been laws that have been implemented to change the way the face of health insurance looked before. But even if you go today where we are with PPOs, where you have the choice, you can see any doctor, any hospital, in or out of network. Yes, it's improved. Here's the difference between health insurance companies and the government. Right now, as we speak, there are unelected bureaucrats being put into a position on a panel called the Independent Payment Advisory Board, IPAB. These people are not practicing general practitioner physicians like these gentlemen. These are bureaucrats that were not passed through any sort of vetting program in Congress. They're just put there by Kathleen Sebelius at Health and Human Services. The decisions they make to cut Medicare cannot be overturned by an act of Congress without a supermajority. So you try to sue IPAB if something is made that's a decision you don't agree with your health care. You can sue a health insurance company all day long, and 99% of the times, you're going to win. Because a jury of 12 is not going to rule against a big health insurance company if they get something wrong. They're going to rule in your favor. Try to sue the government. Congress can't even overturn the decisions IPAB makes now without a supermajority. Well, this is what's happening.
Let's go quickly in the back.
You still have a choice for the HMOs payment. With Obamacare, you've got no choice. That's it. One plan. That's it.
Right. Thoughts, issues, questions? Yes, ma'am, right here. Let's grab that mic. Right up next to you. There you go.
What about people from birth to death who are disabled? How will they be affected by this?
I'll touch that.
Stephen.
All we have to do is look at Blago Care. Blago Care is what was implemented under our former illustrious Governor Blagojevich. See, in Illinois, our governors make our license plates.
Hey!
Was that partisan?
I knew he couldn't control himself.
He rapidly expanded Medicaid from our federal S-chip bill, which was passed under President Bush on a bipartisan basis, then passed and funded again under President Obama. It states that children of the poor should receive free, or little to free, little cost out of their pockets for health insurance. We have that program. It was passed in all the states. Here it's called, used to be called Kid Care, now it's called All Kids. Mr. Blagojevich, in order to entice more voters, and because Chicago is a sanctuary city where illegals can come here and they can't be held accountable, they enrolled all of these people, not just the children, but the mother of the child, the father of the child, onto our Medicaid rolls. They started 2 programs on top of All Kids covered, moms and babies, and family care. And then the Chicago Tribune did an independent study to find out how many there were on those Medicaid rolls right here in Illinois that were illegal, 75%. So when you enroll all those people who the S-chip program was not designed to help, you do nothing but disenfranchise those who those programs were designed to help. And that's what's happened in Illinois.
Yes, ma'am. Front row.
I have more of a comment than
Quick
a
comment.
question.
Brief comment.
I am a victim of good medicine, and I am alive because of good medicine. I had both HMO and a PPO. Under the HMO plan, even if I wanted to pay for a mammogram because I was underage, they would not approve of it. So I had paid for it myself. And it's a good thing I did. Several years later, I had a PPO. And my doctor sent me for a mammogram with no problems, and they found a small tumor in the duct glands, and I am here today, 11 years later. If I have to have someone to place my faith and my health in, I would do so with my doctor and the insurance companies and anyone else, but not my government.
Thank you. All the way in the back. You, sir. You, sir. Grab a mic. Thank you.
I just want your intake on
Hold that a little closer.
if we should have some kind of fraud center set up to where I don't care, he must be 16,000 employees in the IRS. Why don't he put 50 employees in every state to investigate fraudulent doings on doctor's parts? My grandmother had her hip replaced at 90 years old. She was bedridden as it was. Her hip broke just laying in bed. And she was incoherent. What's going on? Should these surgeries be taken on? I think a couple pills here and there should have felt fine. And I'd like to correct the gentleman on the end about Balago. He's making comments. These guys are precise.
Rich, you want to comment on the gentleman's first point?
Doing a surgery on someone that old isn't fraudulent. It might not be ethical, but it's not fraudulent. I can tell you, fraud in Medicare is almost $1 million an hour. I had a patient work for the Inspector General, he educated him on this, and most of it's coming from, no offense, other nationalities coming to our country and setting up scams.
There you go.
And I was very disappointed to read in the doctor's magazine, a family doctor like us, small office, one of his girls on the office staff made a mistake repeatedly. She didn't know it. The doctor didn't know it. Government came in and fined him 30 grand. You know, let's go after the big money. That's where it's coming from.
But my question was that it seems like there's a lot of unnecessary. Another woman had her teeth fixed. 2 weeks later, she wanted different teeth, so they gave her dentures. Now each one of these routines is $1,000. That's coming out of Medicare.
Joe, can I comment?
Joe.
I think that point points to what Joe Walsh was talking about and how Medicare has to change. And the way it is right now, it is completely, in a sense, once you are insured for the supplement, 100% covered. And you can never, ever expect any business cost to go down if it's all covered. People have to have skin in the game. So if they, for example, if we were to change it in some way where all Medicare recipients cannot be 100% insured, and you are responsible for 5 or 10% of the ultimate cost, whatever it might be, trust me, that conversation would come up now. Hey, my grandmother's 90 years old. How much is this hip going to be? And the other thing is, the system has to change and be transparent. The problem is it's not transparent. There's nothing that you don't know ahead of time what it's going to cost. You price it out. So if you want this hip or another hip, and the other hip is more expensive, but it has better studies with it, and you want to pay for that, well, that's going to come out of your percentage as well. So your 5% is going to be higher yet. But the beauty of it, though, it puts you in the driver's seat. You decide, I want it or I don't want it, rather than some bureaucrat just dictating because you're 70, you don't deserve it.
And just briefly, understand, and the docs all know this, Steve knows this, Medicare is fee for service. I mean, docs are incentivized. They get paid when they do things.
I got the medical savings, and that's exactly what you just said. I love it. I'm in charge.
Right. And again, I just want interjection of politics here. One interjection of politics. If government spending were a big pie, there's a lot that government's spending on that it shouldn't be. Correct. But understand, we all got to be smart. The biggest piece of the spending pie is health care for our aging population. Second, it's the fastest growing piece. Look, come home from Afghanistan tomorrow. I'm with you. Bring them home. You'll save $110 billion. Get rid of oil subsidies. You and I can go down the line and check off things that we don't think government should be doing and we could save money. But you're not going to change the bankrupting of this country until your politicians have the courage to deal with, excuse me, health care costs for our aging population. Questions, thoughts, issues, right here. Right here. Hold on, ma'am. Hold on. Go ahead, sir. Right next to you, Rob.
I'll rephrase the question I asked you about from the Stacy. You answered it pretty well, but there's a new audience here. About exemptions. Everybody thinks that if Obamacare is so great, the president's going to be in on it, his mother-in-law, and everybody's going to be in on it, but that's not true. I mean, there's like tons of exemptions, including Senate and Congress and unions.
You mean waivers?
Waivers.
Yeah, exemptions, waivers.
Because, it's not, I was Michelle at my
Well, and again, I don't know what the question
Well,
is.
the exemptions and waivers that are all inside of Obamacare.
Well, to me, the reason that issue is important, I mean, just think, you're the president, you passed this thing, you signed it into law 2 years ago, you told us, and we've got to believe he believes it, that this was the greatest piece of healthcare legislation since Medicare in the 60s. If that's true, Mr. President, why have you granted 2,000 waivers to states, businesses, unions, and organizations to exempt themselves from it? Steve?
It's not 2,000 waivers. When the Obama administration considers one state as one waiver, it is not 2,000 waivers. The amount of people who have been waived from this healthcare legislation is over 3 million people. Now, we had an election in Ohio a few months back, and in that election there were two things that you could vote for, primary issues. One was the issue of public sector union bargaining. That won. Guess what was shot down in Ohio by the public sector unions? Obamacare. The reason it was is because the unions are some of the entities that have received waivers, and they know that their waiver is running out very soon. And they will have to succumb to the higher health insurance premiums, the onerous medical loss ratios on their health insurance companies. This is why it was waived down. So don't let anybody tell you there's 1,600 waivers or 2,000 waivers. There are over 3 million people waived in this program.
Right here, ma'am, and then we'll go here, right here.
Hi.
Use that mic, my dear. Thank you.
I wanted to make a comment about what Steve said. I was in my 20s, I'm 52, and when I was in the hospital, he was saying that it's not that it's a lie that pre-existing conditions are not covered. When I was in the hospital, but I was in there for 11 days in Lutheran General Hospital, and my health insurance was canceled in my 20s. Okay, I'm 52, I'm a caretaker to my mom, 83, she's got a heart condition and Parkinson's disease. My health insurance with Blue Cross Blue Shield is between $1,000 and $2,000 a month, and my mom's is between $1,000 and $2,000 a month. They didn't even cover my ambulance. One time I went $1,000, and then he was cutting down about Medicaid. My friend, everything is covered on Medicaid. I just want to make sure that whoever's going to vote here, that you listen to Obama and Joe Walsh, and make sure that you're hearing the truth, not just insurance salesmen and doctors, but people like us that have to pay $1,000 and $2,000 a month. My mom's medicine was between $12,000 and $24,000 a year. I picked it up. I've been her caretaker for 30 years. I'm telling you, protect yourselves and be careful about who you're going to vote for. Make sure that they're going to cover your individual behinds about health care, okay? Because we're all going to get older. And I just want you to think about who you're going to vote for. Make sure. Hear individual stories, not just insurance men, okay? That, everybody's got their own opinion.
Thank you.
Can respond to that?
Quickly.
Pre-existing conditions, I want you to understand why we have pre-existing conditions. It is not the health insurance company's fault for denying new coverage. They are following a law that was passed in 1996 called HIPAA law. There are far more important things under HIPAA than privacy. One of them is portability. When Congress passed that legislation, they passed what's called portability for 90% of the American insured only. People who buy group health insurance plans only. They did not extend any portability to individual policyholders. That number, since 1996, has grown to 14 million self-employed people who can be denied coverage for health insurance because of pre-existing conditions. It's not the health insurance industry's fault. It is Congress's fault. Had they extended portability protection to all Americans, they would have never had pre-existing conditions in the first place. How do you fix pre-existing conditions? Add that sentence that should have been added back in 1996. All individual health insurance plans are now protected under existing HIPAA portability law. What is portability? You hold a health insurance policy with a group health insurance plan. Group only, because of incompetent federal legislators. Group only. You hold that policy for 18 months, you have no lapse of more than 63 days between your old group health insurance plan with your employer and your new group health insurance plan with your employer. This new group plan must provide coverage for all pre-existing conditions under a law that's over 16 years old. This is why you get a certificate of creditable coverage from your old carrier, and you must give it to your new carrier. It is Congress's fault that we have pre-existing conditions, and Congress can fix it with one sentence, not 2,700 pages, one sentence. And if that's the case, what are the 2,600 other pages about? Control. That's it.
Go ahead, Rich, quickly.
You're talking about taking $560 billion out of Medicare. That means less money for you, the patients. Adding 30+ million people, whatever it is, that means less money for you, the patients. Adding 6,500 IRS agents to police this, that means less money for you, the patients. 159 new agencies to run the organization, all staffed by union government workers, less money for you, the patients. I believe in my heart and my soul, we know medicine. If Obamacare goes through, the #1 leading death cause in America will be death by bureaucracy.
Yes. Let's go right there, sir. Right there. Quickly.
One of the gentlemen in the back talked about fraud. My wife and I have been retired, at least as far as Medicare is concerned, for 4 years. We basically just got a letter from the Social Security Department saying, oh, by the way, the insurance for your pills, you're going to go to the pharmacy, that's canceled, and you're going to have to pay more for it. We said, really? So we called in and we said, what insurance? We didn't know about the insurance for my wife and I. And we found out that for 4 years, this insurance company, and we've had very good relations with insurance companies. My daughter and my wife wouldn't be alive without insurance companies. But the bottom line is, and doctors, but the bottom line is that somebody collected. We went to the Social Security Department, and we said to them, what's going on? They're robbing your money. Who do we talk to? And we even went to our doctor, and our doctor scratched his head and said, I'm so busy making people well that I can't follow up with the bureaucracy. We asked Social Security, who do we talk to? You know what answer we got? Silence.
Ma'am, did you have one? Did you have one?
Yes.
Right there.
My fellow citizens, this is our country, and this esteemed panel is saying all the right things, and we are all concerned deeply. But the bigger picture is, under constitutional law, they are mandating that we all, because we live and breathe, have to buy this certain insurance policy. You give them that inch, pretty soon they'll tell you what car you can buy, how. We already know we only have 1.3 gallons in our toilets. I mean, we cannot allow our freedom to be gone.
Hold up. You had a quick response to something else.
I also want to answer the other part of the woman's question about the high cost of health insurance. I want you to understand that the reason health insurance costs so much is not because of cost shifting. President Obama said that the health insurance premiums are $1,000 higher for everybody because of people who have uncompensated care. They come in the emergency room, they charge up all these costs, those costs are shifted to the health insurance industry. Number one, that is not an issue of higher health insurance premiums, it's an issue of loss of revenue to the federal government because those medical centers and hospitals have to write off those losses, which means you and I as taxpayers pay more. Number two, in 1979, there were a total of 279 mandates placed on health insurance policies nationwide in this country. Fast forward to 2009, before Obamacare was signed, I want you to know that there were 1,900 mandates on health insurance policies, things that were not medically necessary. After Obamacare put another 120 new mandates onto every health insurance policy in the country, including every one of you, starting 2014, $1 of every one of your premiums goes toward abortion. I want you to understand that that's a fact. Included in the last mandate, August 1st, 2011, forced us to pay for Ella and Plan B, which are abortifacient drugs. I want you to see what I mean. 279 mandates. Congressman Walsh, could you help me? These are the mandates on every health insurance policy in this country. Always happens. Okay? Remember, 279. This is post-Obamacare. How many federal mandates have been placed on every health insurance company in this country? Keep going, Joe. Keep going. Keep going. There you go. 2,100 federally imposed mandates. And many of these things are not medically necessary. Many of them, like hair plugs. Let me just go over a few. Joe Biden's hair plugs will be a covered expense thanks to the U.S. tax credit. Health club memberships. In vitro fertilization. What else? Contraceptives, including abortion. I already said that. Radiokeratotomy, LASIK eye surgery, and the big one, infertility. Athletic trainer, massage therapist. Infertility in Illinois alone has driven up the cost of health insurance for every policy in Illinois to astronomical amounts. But that is not a medically necessary expense. It is always the case when you start with the Medicare special subsidy hospital thing that was passed. It was supposed to cost only $800 million. It cost 100 times more in 10 years, up to $11 billion. Every time the federal government gets involved and mandates things that should not be medically necessary,
what happens?
Drives up the cost of health insurance for everyone. My biggest fear is that the Supreme Court strikes down the individual mandate and invents a severability clause that does not exist. What will remain will be community rating and guaranteed issue. Every state that's implemented community rating and guaranteed issue without an individual mandate to purchase health insurance has gone bankrupt because of it. The lowest premium in Bronx County in the state of New York, the lowest premium is $3,150 a month. Let me repeat that, $3,150 a month. It is not we, the insurance industry, who's evilly raising your health insurance premiums. It is an ever-intrusive, growing, bloated government that thinks they know best and try to circumvent the private market. Let the private market work.
Thoughts, issues, questions? Let's go, young man over here. Hold that close to it.
I just have a couple comments. One, my great uncle lived in Germany. My whole family's from Germany. And a couple years ago, he needed to, and he smoked all his life, but he needed a new lung. And it's all federal health insurance over there, so they basically told him, well, here's a list, and you're right here. He died because he couldn't get on that list. And with something that I really don't understand is, where's the logic of that type of thing? How do people want that type of system? I mean, Germany's a country with 88 million people, and they're having overcrowded problems, and we have 310 million people? I mean, I'm 19. What are we looking at? I mean, I'm worried. And the other comment I have is my sister has had disabilities ever since she was born, and they basically told her she wasn't going to live, but because of the amazing just medical system and how, all the surgeries that she's had to have for whatever reason, I mean, I thank the insurance company and I thank the doctors and the medicals. Thank you guys. Thank you.
Anybody want to comment on that? Thank you. Stop down and let